This podcast does not provide medical nor legal advice. Please listen to the complete disclosure at the end of the recording.
Hello, possums, and welcome to Everyone Dies, the podcast where we talk about serious illness, dying, death, and bereavement. I'm Marianne Matzo, a nurse practitioner, and I use my experience from working as a nurse for 45 years to help answer your questions about what happens at the end of life.
And I'm Charlie Navarrete, an actor in New York City, and here to offer an every-person viewpoint to our podcast. We are both here because we believe that the more you know, the better prepared you are to make difficult end-of-life decisions.
So please relax, get yourself something to eat and drink, maybe a margarita.
Hey, yeah.
And thank you for spending the next hour with Charlie and me for our discussion about skin cancer and what you need to know to prevent it. In the first half, Charlie talks about the funeral traditions of Jamaica. In the second half, I'm going to talk about Merkel cell skin cancer. And in the third half, Charlie celebrates the life of Jimmy Buffett, who died on September 1st, 2023 at the age of 76 from Merkel cell skin cancer. Our recipe of the week is in honor of Jimmy Buffett. While looking for his lost shaker of salt, he must have tried margarita cake with key lime cream cheese frosting. And if he didn't, at least you can take it to your next funeral lunch. This margarita cake is made with a cake mix and frozen margarita mix. Add that cream cheese frosting and you could eat your way into a food coma in minutes. Oh, you know what? I ordered a Buddy's Pizza through that website thing you told me about.
Yeah. And
I had Buddy's Pizza for dinner on Friday night. And while I wasn't watching bocce and having a beer off the tap, it was still pretty darn good.
So with, it's obviously not hot out of the oven in Detroit, but were you pleased with the results?
It was good. It makes me want to go have the real thing. Like I was saying to David, as he was like, "Oh, this is great. And it's like, "Oh, but the real thing
it ain't the real thing, baby."
Well, it's like, it's been frozen.
Yeah. No, I understand. It's it's like the old song goes, "Ain't nothing like the real thing, baby." Yeah. To have it hot out of the oven, ain't nothing like it. Yep. Yeah. Okay, here we are. So listen, we were just talking about Jimmy Buffett, and we assume Jimmy Buffett spent some time in Jamaica, which has some pretty wild wakes. Many Jamaicans believe that the good soul of a deceased person automatically travels to Africa immediately after death, while a bad soul tends to hang around the cotton trees on the island and bringing negative energy to the living. Therefore, not only is an unruly celebratory wake supposed to celebrate life of the deceased, but if the bad soul is around, the good cheer will disable the evil and create a passive ghost. A Jamaican wake is referred to as 9 nights. This lengthy party allows enough time for the soul to escape the body and head for its next destination. For 9 nights after the burial, family and friends set a plate of fried fish and cake inside a tent next to the house so the dead can eat. Then they dance and drink and sing loudly until midnight. After 9 nights, the soul is ready to make its trip. Then 40 nights after the death, another party is held. Although it is assumed that the soul has found its way by then, another night of dancing and singing is held just to make sure. Some Jamaicans place several Johnny cakes, the original term was journey cake, in the casket just before burial to make sure that the soul has enough food for the journey. That's a nice ritual.
Yeah, when I was reading about that, remember the Sopranos and the whole thing with Johnny cakes?
Oh,
the who's the character goes up to Maine, runs away to Maine?
I see his face, and
And the guy in the diner makes him Johnny cakes. And well, I hate to do a spoiler alert for our listeners who haven't seen The Sopranos by now, but if you haven't seen The Sopranos by now, I mean, honestly.
Well, it could be a new generation that has not seen it yet.
Well, okay. But the Johnny Cake guy was pretty cute. Right? Yeah.
Yeah. Well,
he could make me Johnny Cakes anytime.
I see. And with that lovely image, please go to our webpage for this week's recipe of food coma covered in cream cheese, frosting, and additional resources for this program. Your tax-deductible donations are always welcome so that we can continue to offer you quality programming. And let's face it, I offer peanuts. It's Marianne who offers a quality programming. And thank you for letting her know. And also thank you in advance for making your donation at www.everyonedies.org. That's dies.org. Marianne?
I'm still thinking about the peanuts you offer.
Cashews, baby. None of this little, salted peanut things. Cashews.
You distract me. So for our second half, we're going to talk about Merkel cell carcinoma. And if you've been listening to the news this week, you know that Jimmy Buffett has died and that his cause of death was Merkel cell carcinoma. And because it's a relatively rare disease, we thought people might be interested in knowing about that. But as I was kind of looking at the data, it's becoming less rare. So let's talk about it and also what you can do so that you can do some prevention. So Merkel cell carcinoma, and I'm going to just call it MCC for the rest of the discussion because my mouth can't say Merkel cell carcinoma over and over again, is a rare and aggressive type of skin cancer. And although it accounts for less than 1% of malignant skin tumors, it's the second leading cause of death from skin cancer after melanoma. Now, it's worth noting that the incidence of Merkel cell carcinoma, see, I said I wasn't going to keep saying that, but here I am, is rapidly increasing around the world by about 8% every year. The cause of MCC is a couple of different things. One is UV ray, the sun, which induces skin damage. Second is immunosuppression and something called Merkel cell poliovirus. Now, there are many viruses that cause cancers, and we're going to talk about some of them over the next few weeks, but this is one of those. This polyovirus infection, now these are double-stranded DNA viruses that cause tumors in mammals. And so we're learning more about them. Not a whole lot's known, but there are a few that we're aware of, and actually there are some vaccines for some of them, HPV in particular. Now, these viruses are thought to be the major risk factors associated with MCC. The fourth cause is arsenic poisoning, and it's related to a higher chance of Merkel cell carcinoma. The positive association between MCC and UV radiation has been well established. Fair-skinned individuals have a higher chance of MCC than do those of us with darker skin, meaning, Charlie is a Mexican, me is an Italian,
Yeah.
We have some protection there. But you fair-haired people, you got to be careful. You got to be careful. More than 50% of lesions typically develop on sun-exposed skin, like the head, the neck, and the arms. And actually, if you look at some pictures of Jimmy Buffett over the last few years, if you notice, he's wearing a hat, he's wearing sunglasses, and he's wearing gloves. And I didn't notice that in pictures of him, but if you look back now, hindsight's 2020, you notice it. MCC is also frequently diagnosed with other tumors that are associated with skin exposure. Now, other characteristics that support the link between UV radiation or the sun and MCC are the higher occurrence of chronically sun-exposed older people and the higher incidence in people who are treated with UVA phototherapy. Therefore, I'll be talking about the need for sun exposure protection in a little bit. MCC usually occurs in older people between the ages of 70 and 80. People who are diagnosed with MCC also have an increased likelihood of having other tumors. The coexistence of MCC with chronic lymphocytic leukemia has been well documented. Now, immunosuppressive conditions such as lymphoproliferative malignancies. Now, lymphoproliferative disorders are a group of diseases characterized by the uncontrolled production of white blood cells called lymphocytes. So examples of these diseases are leukemia and non-Hodgkin's lymphoma, to name a couple. People with organ transplant and HIV infection are important risk factors. Approximately 8 to 10% of MCC cases are related to severe immunosuppression. Data from population-based cancer registries show that patients who undergo organ transplant had a 24 higher risk of developing MCC compared with immunocompetent patients, and this risk increases with time from transplantation. Now, a lot of people think, I'll get a transplant, everything will be fine, and that can be, but there is a very high risk of skin cancer, and all the interviews that we did with Steve, who had the lung cancers, one of the things he developed was skin cancer toward the end of his life. In addition, incidence rates rise steeply with increased age at transplantation. So the older you are when you have the transplant, the increase the risk of having these cancers. So what does an MCC lesion look like? MCC usually presents as a rapidly growing nodule that's like a nodule's a bump on your skin. That is solitary, means it's one of them, painless, and it's firm. So when you touch it, it's hard. And it has this red-violet or red-blue appearance. They generally appear in parts of the body which get maximum sun exposure. The main symptoms of Merkel cell carcinoma include the presence of lesions on sun-exposed skin areas. These lesions are often seen on the regions of the neck, head, upper and lower limbs, and the main body, the trunk of your body. The MCC lesion may be mistaken for benign lesions or other malignancies, such as squamous cell carcinoma, cutaneous lymphoma, or metastasis from another tumor. MCC diagnosed in people with chronic UV exposure will have a greater than 50% of the lesions in sun-exposed areas like the head, the neck, and the arms. The acronym AEIOU can be helpful as a diagnostic tool. It stands for A, asymptomatic, meaning you don't have any symptoms. E is rapidly expanding. I is immunosuppression. O is older age, meaning at least 50 years and older. And the U is UV radiation exposure. And when we say that, we mean the sun. Most patients with MCC present with 3 or more of these characteristics. Diagnosis of MCC can be made by a physical examination by your healthcare practitioner. Typically, they'll do a biopsy. They'll cut in to that lesion and send it off to see what the cells look like. They can do imaging testing like an X-ray or CT scans and blood tests. Now, according to the American Joint Committee on Cancer, MCC is classified in a stage 0 to stage 4. And cancers are typically talked about in 0 to stage 4. And I've had patients where, they've said to me, it's only stage 4. And I'll say, well, how many stages do you think there are in cancer? And they'll say, there's 10. There's 10 of everything. And typically I'm the one who says, well, actually, there's 4 stages. And I get this look like, holy crap. Nobody has ever told me that there's only 4 stages, and I'm in that stage. So I share that with you too. If you don't know that there are only 4 stages, there are only 4 stages. So they're classified in stage 0 to 4, and the life expectancy of a person diagnosed with MCC is dependent on the stage of the disease at the time of diagnosis. So when you're diagnosed is when they look at life expectancy. So let's go through that. Stage 0 is in situ. In situ is a Latin phrase that translates literally to on site or in positions. It means locally, on the premises. So stage 0 means it's there. Stage 1 is a localized disease with a primary lesion that's less than or equal to 2 centimeters. So if you look on a ruler, our rulers have inches on them, but they also have the centimeters, those really little slash marks. So if you look at that and you look at what 2 centimeters look like, stage 1 is equal to 2 or less than. Now, the 5-year survival for stage 1 cancer of MCC is 62.8%. And a lot of times, because we're hopeful people and we want to have it in a hopeful way, it's like, what, 63% of people, survive this. But, you can put it another way, and you could say that 37.2% of people with stage 1 will die in the 5 years following the diagnosis. And that's more than a third, right? So when you listen to prognosis, when your mind is ready to put it in the other way too, because you have to make decisions about what treatment you're going to have, or if you want to have treatment, or how far you want to go. And if you're only thinking, well, 63% will survive in 5 years, let your mind also have the data that 37% will not. So, stage 2 diagnosis, stage 2 MCC is a localized disease with the primary lesion, that lesion that they found, is greater than 2 centimeters. The 5-year survival for stage 2 is somewhere between about 35% and 55%, which, if you put it the other way, 45 to 65% of people will die in the next 5 years of that disease. Now, stage 3 is what they call nodal disease. The 5-year survival for stage 3 disease is somewhere between 27% and 40%, meaning 60 to 73% will die in the following 5 years. The nodal metastases are seen in about 30% of the patient at the time of diagnosis, and in greater than 80% of patients over the course of the disease, meaning that more than 80% will have metastasis to their nodes. The life expectancy of a patient is also affected by the number of lymph nodes that are affected. So the lymph nodes are in your neck, in your armpits, in your groins. They're like the little filters of your blood. All the blood goes through your lymph nodes, and they filter out stuff. So if the cancer goes and gets into your filters, into your lymph nodes, that means all the blood is going through an area that has cancer cells in it, and it can pick up those cancer cells and take them to other places. The 5-year survival of a patient with 0 lymph nodes affected is 76%. So 5-year survival, 0 lymph nodes, 76%. If you have 1 lymph node that is affected, 50% survival. 2 lymph nodes is about 47%. 3 to 5 lymph nodes, 42% 5-year survival. And if there are more than 6 lymph nodes affected, 5-year survival is 24%. Lastly, stage 4 disease. This is metastatic disease. So stage 4 means that the cancer cells have gone outside of wherever it is that they started. So metastatic disease beyond the local nodes. With this cancer, the spread is typically to the lungs, but it can go to any place. 5-year survival for stage 4 is 13.5%, meaning that almost 87% will die within 5 years. Now, in terms of Jimmy Buffett, he was diagnosed 4 years ago. So that gives you kind of a sense. We haven't been told what stage he was diagnosed at, but you can kind of figure that out. The treatment includes anti-cancer drugs, radiation therapy, and surgery to remove the cancerous tumor, along with some of the areas of the skin surrounding the tumor. So if you've heard of people saying, oh, they got clean margins, that's what they're talking about. They take out the tumor, and then they take out the skin around the tumor because they want to have all the cancer gone and to be able to say we were able to get clean margins, meaning that that area that they took out, there's no cancer left right there. MCC can spread beyond the skin, meaning that it can metastasize even with treatment. It can travel first to the nearby lymph nodes and then spread to the distant areas like the brain, the bones, the lungs, or liver, and interfere with the functioning of these organs. So, what can you do to prevent MCC? Sun exposure is a known risk factor for MCC and for skin cancer in general. And I'll tell you, as a mom, I've always been a bit of, I don't want to say overprotective, but on point about it. Let's put it that way. Because there's data about children who've had severe, and I'll share that data with you in a minute, severe sunburns put them at risk for skin cancer in their older age. So I didn't want to do anything to my kids that was going to, harm them in their older age. So we would go to the beach, Seabrook Beach, with friends, and we would line up all the kids on the picnic table. There were 6 altogether, and we would, slather them down. And we wouldn't let them go to the beach until they had that, and they'd put their hats on. And when they were babies, I have pictures of the kids with, sunglasses on. Of course, now they're in their 20s. They, lay out with oil or nothing on their skin, and they make me crazy because, they've got, skin damage. I can see it on their beautiful little faces. And I'll say, you're going to regret that when you're old and you have all those lines and all those freckles. And they're like, yeah, Mom, whatever. So if they're not going to listen to me, I hope you all will. So what do you want to do? So you need to avoid sun exposure during peak hours. So that's typically from like 10 to 4 when the sun is at the strongest. Now, I don't avoid the sun, but when I go outside, I have a hat on. They make these shirts called rash guards that have sun UV protection in them. They're long sleeve, but they're really light. So you can wear that and cut down on your exposure. Put your sunscreen on. When the kids were little, they call it sun cream because I guess they didn't understand my accent. I don't know. But, put your sun cream on and make sure that it's at least a 15 SPF. And also, don't keep your sunscreen forever. It expires. Look at the expiration date on the bottle. If it's on sale at CVS, chances are it's almost, expired. So be sure you look at the expiration date. You want to shield your skin and your eyes by wearing appropriate clothes, wide brim hat, an umbrella. When I still go to the beach, I sit under an umbrella. And I recently bought we got a house that has a pool in it this last year, and I bought this floaty that has this sun canopy over it, so I can read my book, but my whole upper body is shielded. Put on your sunglasses and be protected. You want to apply sunscreen with an SPF of at least 15 frequently and generously, just like you donate to Everyone Dies. For children, be sure that you're using sunscreen, hats, sunglasses. Severe childhood and teenage sunburns are more than twice as likely to lead to skin cancer. If you get 5 or more blistering sunburns before age 20, your risk could soar to 80% for skin cancer. So you might be, 40 years old, not even remembering those 5 or more blistering sunburns, but your body will. So parents, you've got one more thing to nag your children about. Watch for changes in your skin, like the appearance of a freckle, a mole, or a bump, which is changing color, shape, and size. And then be sure to inform your healthcare practitioner about it. One year I love the OBGYN who delivered my babies. And I, of course, go see her every year for, the woman stuff. And she had this thing on her nose one year. And I'm looking at it because, you can see their face. And I said, have you had that, whatever that is on your nose, looked at? And she said, I've been wondering about this. She says, it just won't heal. And it bleeds. And I said, that's a skin cancer. You need to, I'm like, hollering, that's a skin cancer. You need to go get that looked at. So the next year when I go back to look at her, she's got, obviously some surgery. I said, so was it skin cancer? She said, oh my God, you're right. She said, I went to my doctor right after that and I got hollered at for letting it go. And it's like, so see, even healthcare practitioners don't want to see what's right on the nose of their face. The next thing is, do not do indoor tanning. Do not do it. Don't do it. Don't use a tanning bed, a booth, a sunbed, a sun lamp, anything to darken your skin. These expose the users to high levels of UV rays. Over time, too much exposure to UV rays can cause skin cancers, cataracts, and cancers of the eye. Indoor tanning accidents and burns send more than 3,000 people to the emergency room each year. And if you think about I don't know if you think about how they tan leather, they take softly, leather, the skin of a cow is soft when you take it off. But what do? They lay it in the sun. And that nice soft skin becomes leather. And that's what you're doing to your skin, folks. Cover it up, wear a hat, protect yourself. Please remember that skin cancer is the most common cancer in the United States, and that 20% of Americans would develop skin cancer in their lifetime. Charlie, any questions or thoughts?
Yeah, lots of thoughts. And as you were speaking, it's like, okay, yeah, I do that. Okay, I don't do that. I am careful about that. In general, I knew all this, but wow, that's a lot. One thing, so, with climate change and everything, and it just seems that the sun is more intense. It's not. The sun has been around for billions of years, but with climate change, is it even a higher probability now? Easier to get, skin cancer?
Well, with the breaking down of the ozone layers, you are getting stronger.
That's what I'm trying to say. Thank
rays.
you. Okay, that's it. Yeah. Yeah.
And it depends on where you are relative to the equator. The closer the equator, the closer you are to the sun. So geography matters. And also your skin. Like you and I are historically from places with lots of sun and, survival of the fittest. Our genetics allow us a little bit of latitude. But if you're fair-skinned, you don't have the latitude. And that's not to say that those of you say, oh, well, Marianne says if you're Italian, you don't have to do this. No, I'm Italian and I still do it.
Yeah.
I'm just saying you got a little bit of latitude. But I'll tell you, first, I wash in the morning, shower, wash my face, and I put sunscreen on every morning. Even if I'm, sitting in the office writing scripts for Everyone Dies, I still have sunscreen on. Because those scripts are hot.
But you're indoors, so why would you put sunscreen on indoors?
Yeah. Well, so do you not go out and walk the dog? Do you not go out and check the fish? Do you not go, oh, I forgot something from my car?
Generally no. but I see what you're saying. Okay, yeah. Oh,
but you'll go in and out without even thinking about it. So if you just put it on, And then I like to garden. So right outside my back door, I have a table with like my gardening stuff, and sunscreen is right there. So you don't, because if I forget, it's like, oh, no, it's right there. So, David goes for a run, he can slather up. I go out and work in the garden, it's right there. So make it easy on yourself. I mean, sunscreen's not that expensive. Skin cancer is far more expensive. And if you talk, I've talked with, my dermatologist about, because I've worked in oncology, about different cancer treatments, and the treatments for skin cancer take a lot of time. You've got to go in, and they go in layer by layer, removing those cancers. And, I'd rather use my time putting the sunscreen on and kind of running around. So this is one of those things that is, not everything's in our control, and this isn't completely in our control. But we have some control. Yeah. We can do the right things and lower our risk. The risk is never going to be zero, but you can lower your risk tremendously.
Thank you.
Thank you.
Here are a few fun facts about Jimmy Buffett. The island Jimmy Buffett lived on was Long Island in New York State, specifically Sag Harbor on the eastern end of the island. He sold at least 23 million albums in the United States alone, on par with another Jimi Hendrix. Buffett was a billionaire. And from the New York Times, the backdrop to Buffett's party tunes is often one of relief, not entitlement. He sings about mistakes, regrets, work, longing, nostalgia, and, beginning decades ago, the inevitability of aging. I can see the day when my hair's full of gray and I finally disappear, he sang on his 1983 song, One Particular Harbor, a staple of his live sets. Jimmy Buffett's death affected his fans around the world. Musician Danny Kelly wrote the following as his tribute to Jimmy's life. The passing. The blender is broken, the circus left town, and that lost salt shaker was finally found. The kid weighed the anchor, the drifter sailed away, and all of the parrot heads are in such disarray. Jimmy, you held the magic, your passing was tragic, we feel like we've drowned. You were the life of the party when the summertime came. We put on our grass skirts, we danced in the rain. We sang along with you, we were kids for the night, and just for a few moments, the world seemed so right. We need some cheap airfare, got to fly to Saint somewhere. We're going insane. And the stars fell on Alabama tonight, and the Gulf Coast is clear and blue, as the son of a sailor reached that far distant shore and passed through. And that's it for this week's podcast. Please stay tuned for the continuing saga of Everyone Dies, and thank you for listening. This is Charlie Navarrete, and from writer Mark Twain, why is it that we rejoice at a birth and grieve at a funeral? Is it because we are not the person involved?
And I'm Marianne Matzo, and we'll see you next week. Remember, wear your sunscreen. Yeah. And every day is a gift.
This podcast does not provide medical advice. All discussion on this podcast, such as treatments, dosages, outcomes, charts, patient profiles, advice, messages, and any other discussion are for informational purposes only and are not a substitute for professional medical advice or treatment. Always seek the advice of your primary care practitioner or other qualified health providers with any questions that you may have regarding your health. Never disregard professional medical advice or delay in seeking it because of something you have heard from this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Everyone Dies does not recommend or endorse any specific tests, practitioners, products, procedures, opinions, or other information that may be mentioned in this podcast. Reliance on any information provided in this podcast by persons appearing on this podcast at the invitation of Everyone Dies or by other members is solely at your own risk.